I heard something today that I've never heard before, and it was effectively, to paraphrase, I work in healthcare. I work, at this organization, and I don't hear the people in the other silos, but I don't hear what my leadership says. And so I had to come here from west of the mountains so I could hear what my leadership thinks, because I can't hear that back at my agency. I hadn't heard that before. I thought that was a powerful statement. So I hope you are experiencing some of that, which I'm hearing, which is this is a unique kind of place that only happens because we are all invested in it. We're all stakeholders in it. I think it's a special conversation. I want to move into our program, but before I do, I want to take one opportunity to just flesh out something I said earlier and highlight this flyer. We are trying to hire freelance folks, as I have said, to cover what's happening in Olympia full-time so that they can provide on-the-ground eyes and ears. And we are not journalists. We don't hold ourselves to that ethic. We're not trained as journalists, and we're not that good. But we do try to provide analysis, and we do try to provide thoughtful feedback. And so folks who are working in healthcare every day who can be full-time reporters and analysts, I think, will help us all. And so, as I said, to fund that, we're starting this job board at stateofreform.com, and we've literally just started it here in the last few weeks. We revamped our website, which some of you may have noticed, which has so much content on it. We feel a little bit like we overwhelm ourselves sometimes with all the different stuff on there. But if you have an HR department, or if you have somebody who would be interested in posting senior healthcare executive positions, we'll send out one email a month listing those jobs on the email to all 35,000 of our email addresses, so your jobs will be right in their inbox. They'll be in your inbox. And in September, we're giving away basically all of our posts for free. Don't tell anybody. Just because we want to get jobs up there and we want to get people using it. So if you have a job in your organization, let us know. You can email us at jobs@stateofreform.com, and we'd love to work with you. And then moving forward, this is effectively a coupon. You have by attending, you'll get $100 off, and we're already cheaper than anybody else, basically. So we just want to get people thinking of this as another tool to help communicate to the broader healthcare executive leadership community, both in the policy world and in the private sector. Enough of that. I want to invite up to the stage our panel members, and first, Senator Linda Evans-Parlett, the caucus chair of the Majority Coalition Caucus, the Washington State Labor Council Director of Government Relations and Exchange Board member, Teresa Mosqueda, and the president of the Empire Health Foundation, Anthony Chang. Thank you for coming up and for participating. As you walk up, I want to note that this has been when you get 60 people on an agenda, sometimes it becomes a little bit of a moving, an exercise in sort of moving parts, and this is an example of those. We started this panel with the idea that we'd have 3 exchange board members. And if you haven't noticed, the Exchange Board has been very busy in the last few weeks. And so things have evolved, and we now have these 3 speakers who will still speak to the Exchange in their various capacity. One is an Exchange Board member, one is one of the most senior-most members of the Washington State Legislature, and frankly, one of the best minds in the legislature on healthcare. And one of the most important civic and nonprofit leaders in Washington State in terms of funding and thinking about system redesign, who is also has won the Navigator Grant and the In-Person Sister Grant for the Exchange. So I want to have just a real open conversation with them and poke them a little bit, not too hard. I haven't told them any of my questions. You'll see I have no notes, so I may or may not have prepared any. We'll see. But I want to start with you, Teresa, as an Exchange Board member, as a Director of Government Relations, knee-deep in this stuff, and get your thoughts on how things are going and what the last few weeks and maybe the last few months have been like watching this come together.
Great. Well, first of all, I want to say thank you for having me on this panel. This is a really wonderful opportunity. And what a great time in Washington to evaluate the state of reform. We are less than 20 days away from going live with health coverage for those who've been shut out of health coverage for many years and for way too long. And it's really a privilege of mine to be able to sit on the exchange board. I do want to be very clear today that my disclaimer is that I'm not representing the board today, and the opinions that I share today are my own, and they're really coming from the consumer advocate's perspective. And I think that the process so far has been one that's been very public. It's been an up and down process. In my opinion, there are so many things that we want to do by October 1st. The list continues to be reprioritized and then prioritized again. And so it's been a challenge to think of all of the items that we'd like to see in place by October 1st. For me, I keep saying, yes, we have to have the door open on October 1st, and we need to have the lights come on. And that is absolutely true. We need to have all the IT systems connecting and talking and have the system so people can actually enroll. We also, I think, have a responsibility to make sure that on October 1st, the door opens, the lights come on, and the first through the door are the most vulnerable, the lower income, the folks who've been left out of health coverage for so long. I think it's over 60% of uninsured population have been uninsured for over 2 years. And so the possibility that we are just days away from opening up health coverage and having folks come through the door who haven't had health insurance is monumental. I think it's been a really wonderful process as well to try to work in a multifaceted way, all the way from the state exchange to the Office of the Insurance Commissioner, our state healthcare authority, up to the federal Health and Human Services. Everybody has had to have all hands on deck to be really flexible and work in a really fast-paced and creative way to make sure we're up and running by October 1st. And that's required us to be really, I think, willing to think through different policy options, think through different timelines that may have seemed like a requirement at the beginning, but there's a necessity to push back some timelines sometimes in order to get things right. And I think we're going to get it right for the door to be open on October 1st, and then we have a lot of work to do ahead, as we've heard this morning, to make sure that health insurance doesn't mean just an insurance card, that it actually means access to comprehensive, affordable health coverage, health care in your community by a trusted provider. So while we've had some great steps so far, there's much more to do, and I'm really excited to be part of the discussion today to talk about this.
Great. Thanks for being here. Senator, as caucus chair of the Majority Coalition Caucus, you're in a unique position, a bipartisan majority in the Senate. As sort of preface to the question of how's it going, let me say, when we host this event in Alaska, I can only refer to health reform as Obamacare. Mm-hmm. If I call it the Affordable Care Act, I will not be heard. Likewise, in Seattle, if I ever call it Obamacare, I get rushed out of town on a rail. I'm not sure how to call it in Spokane. But I know that this thing that is health reform is highly political and highly polarizing. How are you sort of, what are your thoughts as you watch this unfold? Because as we discussed briefly over lunch, the legislative process for developing the exchange was a very animated conversation in the legislature. How are things going from where you sit?
Well, to begin with, DJ, thank you very much for asking me to participate. And over here in Eastern Washington, we're friendlier. And thank you for having this in Spokane. Look at this great turnout. I think it's wonderful to be a pharmacist in a rural area. I think that has helped me as far as a policymaker. I think today is a little bit different than a few years ago when the Affordable Care Act passed, because we were all in shock. Many of us were not happy. Some people were happy. The exchange legislation, there have been 3 bills, one for this year, last year, the year before. The first 2 bills I voted no on. This year I voted yes. This year was the funding mechanism for the exchange. The first year was how to establish an exchange, and it ended up being a public-private partnership. And then the second year, the second piece of legislation had to do with rules and market things like that. The big topic of discussion for the legislature was who will be on the exchange board to start out with. And it turned out that those people, names would be submitted from all 4 caucuses and also the governor's office. So I think we're happy with that process, rather than just have the Office of the Insurance Commissioner or the governor appoint the exchange. So I think that was a good compromise. My caucus probably felt that the rules that happened in the second year of legislation were excessive. I think my caucus believes that the exchange should be more of a market organizer and should offer lots of choice, lots of competition, because we will know if it works if people buy insurance, and they have to afford it to start out with. But I think now, because we've passed 3 pieces of legislation, and the one this year was to fund the exchange so it wouldn't come directly out of the general fund. Those of us from my caucus have accepted it is here, and so this system, which is not perfect. I mean, my good friend Representative Cody, we both chaired the healthcare committee in 1999 and the year 2000 when we had the 49-49 split. And I mentioned over the session, during the session with Eileen, if you and I were making changes, we would agree what needs to be changed. We already know where the problems are. And hopefully people will speak up, and it doesn't mean, in my opinion, again, I just speak for myself, not for my caucus. We've tried a new thing here. It's not perfect. What's the next step? Time will tell. And Washington State's always been a leader, and I think we continue to be a leader in healthcare.
Yeah. Good. Anthony, one of the conversations that the Exchange Board has and the legislature has is, okay, we've got this bill, that's great. How are we going to get people to sign up, either for Medicaid or for the exchange? How are we going to engage consumers to use this new tool when it only takes them, pick your number, of minutes to fill out the paperwork and go through this challenge? And as you know, one of the tools to help people get through that is funding from the Affordable Care Act that creates these navigators who are compensated to get people enrolled. And your organization, the Empire Health Foundation, has won a grant for a significant portion of Eastern and North Central Washington to provide that service. So tell us your thinking about how this consumer engagement piece is happening, and what are your thoughts on the Navigator project over the next 6 months?
Well, it might be an unusual perspective, because we actually have the perspective of being a funder. So we consider ourselves a co-investor with the public sector and other folks in the private sector in trying to achieve better outcomes for the communities that we serve, just like you were saying. And ultimately, are more people getting access to care is one of our key metrics. So we started off this process not as a grantee, but ironically as a co-investor. So we made specific investments. I'll just give a couple quick examples. We took advantage of a Robert Wood Johnson matching fund for grant writers. We invested about $20,000, made that $40,000 because it was a 2-to-1 match, helped DOH land $3.25 million for community transformation grant prevention dollars. We then invested the following year $15,000 and got a 3-to-1 match for $60,000 to help the HBE get the $129 million exchange grant. So we were investors up front to say, how do we give a power boost to our partners at the state, at the public level? And we would like to see some of that impact, of course, coming to Eastern Washington. Ultimately, that's our mission. And the irony is, when the RFP, the draft one, first came out for the Navigator program, as was known initially, and maybe known again, by the third or fourth time that I heard a hallway conversation along the lines of, well, this is not our sweet spot, but we're thinking of applying for this RFP because we don't want so-and-so to get it. And we're worried about the competitive landscape. Or we heard things along the lines of, there's a for-profit firm based in California that is going to cherry pick Spokane because it's, guess what, profitable to do the state contract as the lead agency, but is going to orphan our rural communities. So we said that neither one of those are good signs. So we began convening the conversation, the ecosystem around this, and to cut to the chase, much to our surprise, as we began doing the financial analysis, figuring out how to optimize the network of folks that could do the consumer side of things, that coalition basically said, what if Empire Health Foundation took the lead? And so we found ourselves in this sort of surprising situation where we helped, we hope, give a power boost to the state to land some of that resource, and yet we were being asked to take this unusual role here in Eastern Washington. To give you some idea about the kind of ripple effect, we only serve 7 counties in Eastern Washington, 6 of which are rural. And we had some pre-existing relationships with folks, specifically Jesus, wherever you are, in Community Choice. And so we said, let's partner and have an 11-county range. And then after we were accepted by the HPE, we were asked to take on an additional 3 orphaned rural counties. So we now have a 14, we're the largest geographic region. And if you had asked me even 6 months ago that we would be in this role, I would have said, you're crazy. And I predict by the end of the 18-month initial contract, we will probably end up investing an additional 1/3 to 50% above and beyond the state/federal monies. And part of why we're doing that is we're saying, look, what better opportunity is there to take the already aggressive enrollment targets and let's go for a whole nother level. And so what are some of the strategies? I don't have enough time to dive into those, and I'm probably the last person to be answering that question from my team. But all this to say is, we have a sort of this unusual funder perspective, but because it's such a dynamic time, we've found ourselves in a hybrid mode.
Yeah, interesting. So, Senator, I am struck, I'm hearing it here, but I'm also hearing it a lot of places, about how much work is going in right now into healthcare, and how dynamic and exciting this time is. And you were elected in '96 to the legislature first. You're a pharmacist, as you mentioned, at Wenatchee Valley Medical Center. You have been working on this stuff for a long time in a lot of different ways. What is it like to be in a place now where everything is moving, and maybe for a large portion of your career, it felt like maybe nothing was moving, and now nothing is standing still? What's it like now as you experience this period?
Well, I think it's exciting, and it's helpful to know the language a little bit. Last night, I met one of your new employees, and actually, you were in the conversation too, Anthony, and he's only been with you for maybe three weeks, and this guy wouldn't stop talking. And I said, you, Ramir, you will be just like him in 2 years. I mean, you will be excited, you'll be talking. I mean, I don't know what it is, but it just happens that you feel comfortable in a crowd like this. Not that everybody agrees all the time, but in the end, we all care about, just as you said, access to health care and health insurance when you need it. We want the system to work. And I think we all know each other well enough, those of us who've been in this system, to know who to go to try to fix programs and problems. And as you said, you added a few counties. Well, those are 4 of the counties that I represent in North Central Washington. And we are rural. So that's great. We don't know all the answers, but it's exciting to have our state involved and to be able to work together and not offend each other if we don't agree and try to come to some conclusions. I mean, just to watch the exchange board, I was absolutely thrilled when they also said, hey, we want more choice, we want more competition. I was appalled that only 4 insurance companies, and really it was 3, that were accepted to start out with. And in my area, we don't have group health, so we have a limited choice in North Central Washington. So I was thrilled to see the exchange board be on the same page and say, yes, we want more choices. So I think we're evolving, but it's in a positive direction.
I think that is so interesting. I follow this stuff way too closely. I need a hobby. But when
Illness.
it is, yeah. I need some behavioral health integration over here. When the insurance commissioner on July 31st announced that 4 of the 9 insurance carriers had been accepted and that the other 5 had not, and as you mentioned, one of those carriers was LifeWise and one was Premera, which are essentially the same plan or similar plans, owned by the same holding company. To watch the process that unfolded, which included your very public remarks, which included the exchange board, really, taking a stand and shining a light on what for many insurers, for the insurers in the room, have long argued was sort of an opaque and not very effective process to work through the insurance commissioner's statutory responsibilities in approving plans to enter the market. And the commissioner has argued that it's not his ideal situation, it's not the situation he'd like, it is just what, in his view, is he is statutorily required to do. But this very interesting thing happened in August where all of a sudden this light shined on that process. And at the end, I think all 9 carriers were allowed to enter the market. Maybe there's only 8, maybe I'm not following it closely enough, but I think 8. Nobody gave any of the plans who appealed a chance, really, to win their appeal. Teresa, what was that like from where you sit? To watch that unfold, you guys were front page, top of the section in the Seattle Times. That never happens when it comes to insurance regulation, right? And there you guys were, sort of carrying the banner that consumers need more choices than just 4 plans, and in some counties, just 1 choice.
Sure. Well, I think what consumers need is access to high quality care. They need access to comprehensive care to make sure that if a provider is within a network, that there's actually access to that provider in the community. And I think that that's fundamentally what consumers need, and that's fundamentally what we want out of healthcare for consumers. I think the insurance commissioner has a tremendous job that he does every year to look to make sure that plans that are submitting applications meet those rigorous standards, that consumers are actually going to be able to access care, that it's going to be high quality, that it's going to be affordable, and that it's going to be available. And I think what we saw this year was a real effort to try to say, as a community, what do we want out of healthcare reform as we launch? And what we want is those high quality, accessible, affordable plans to be available for all populations, at all incomes, in every corner of the state. And in order to make sure that we had those high quality choices, which include the Medicaid managed care plans, we had to be flexible in our timeline. And that timeline was really driven by the federal government. And as you've heard before, this morning and in the paper before, we've had to, and many times, ask the federal government for some flexibility. They've had a number of regulations that were slow initially to come out. And then there was a flood of regulations that came out earlier this year. One of my colleagues said it was so many regulations coming forward, it was like Reglapalooza, and it just didn't end. And so what we had to do is to say, listen, we've been trying to both build this plane as we fly it, also come up with policies in the absence of regulations, and then have to be flexible when regulations finally come forward. And in this situation, when it came to qualifying health plans, we're asking you now, the federal government, to be flexible with your timeline, to give our state additional time to review the plans and make sure that all of the plans who had submitted applications to provide coverage in the exchange, that we could get those plans up to a higher quality, a higher standard, so they met the standards necessary to offer coverage as a qualified health plan. And in order to do that additional review, we needed additional time. Everybody had all hands on deck to ask the federal government for additional time. Once that was allocated, the Office of the Insurance Commissioner and their staff and the exchange staff worked very quickly and very deliberately to try to get all of those plans through the process. And what you saw was a win for consumers. As you said, what we want is high quality choices for everybody, and especially for those lower income folks who are going to possibly fluctuate between eligibility for the exchange and Medicaid. It'd be great to have a health plan available in the market that allows them to fluctuate as their income changes and maintain their quality of care with their trusted providers. And that's, I think, the ultimate outcome. It's been an interesting few weeks, and I think that it's to be expected as we get this entity off the ground. It's a historic moment and is monumental. It also requires us to think quickly, collaboratively, and be flexible.
Yeah, Anthony, as we've discussed before and again in the last few days, and as both Senator Parlett and Teresa are speaking to, even though we're so busy, spending all of this time doing all of this work, it's meaningful to people. This work really matters, right? And I know you think a lot about this and you care deeply about this, and shed some light on how you approach this work.
Absolutely want to come clean, and people ask me all the time as a regional health funder, what do you think about the Affordable Care Act? I get asked that all the time. And I've come to the point where I just have to be authentic. I tell them I am a huge champion of universal health care. We are the last industrialized country to have some form of universal health care. And yet, I will grudgingly now publicly admit that I think the ACA is perhaps one of the most convoluted, perhaps worst ways in which to take a step forward in that. And it's hard for me to say that, yet it is a step forward. And for those of you here in Spokane, you might remember T.R. Reid, who's the author of Healing of America. He's a Washington Post reporter that went and looked at all the other industrialized nations and said, are there any lessons to be learned here in the US around trying to implement some form of universal health care? And someone asked him the question, this is probably my favorite part of his remarks, what country are we the most like that we could learn the most lessons from? And he said, well, it's kind of a trick question you're asking me, and you don't even realize it. Because we really have 4 countries that we're like. One of those 4, if you have served our country as a veteran and a member of our armed forces, you have the system of England, which many folk call socialized medicine, so on and so forth. But basically, whether provider, payer, any part of the system is one entity. If you are 65 or older, and in many states, a child, 17 or younger, you have the system of Canada. And in fact, our Medicare system is literally named after and copied from when Canada implemented its system. And then for 60-some% of the folks, we have the system of Germany, which is private sector pretty much at every layer. And he said, but then the 4th one is for, unfortunately, nearly 20% of our fellow citizens, our family members, our community members, we have the healthcare system of Rwanda or in India, which is you only get what you can pay for, and guess what? You can't pay for anything. And so as we are so heads down in all of this, the processes through August with the exchange, and which plans were got on, and the transparency of that process, let's not forget that while a challenging form of it, this is a step forward in that access, in providing a level of health that so many of our fellow community members just don't have today.
Senator, there's a wide diversity of opinion on what the path forward ought to look like in healthcare, and maybe not any sort of majority anywhere on what that path forward might look like. But I'm struck as we're talking. I was in Alaska earlier this week. I gave a presentation, and one of the points I made was that we in Alaska at the time, this is the most expensive state for healthcare in the country. That is the most expensive country for healthcare on the planet. And I asked if anyone thought that was a badge of honor. And this is in Wasilla. I gave this presentation, and nobody in that very conservative community thought that was a badge of honor. And sitting here thinking during this conference, it dawns on me that if you just take out Washington State or any state in the country, and called it its own country, absent the other 49, it would probably be the most expensive place to get healthcare in the world on its own. In other words, even though in Washington we might be better and a leader in the country in terms of healthcare and keeping the cost of care down, we're still not very good compared to the rest of the developed world in terms of costs and in some cases outcomes. The outcomes are variable. How do you approach this Herculean task of trying to make the system better from the view of a legislator, of a policymaker who understands healthcare, who is committed to healthcare in terms of trying to find solutions, particularly on the affordability side. You've worked on this a long time, but the task is so hard, and there's no majority opinion in terms of a pathway forward. We can all agree that it needs to be fixed, but how do you, as a senior member of the legislature, try to pull your caucus together towards any sort of pathway forward?
Well, sometimes on healthcare issues, it's not just a caucus. Sometimes individuals within a caucus have difference of opinion. I have always focused on choice and competition. I just met somebody Tuesday who's been in Wenatchee for 3 years. She moved from Oregon, and the same policy in Oregon was $300 cheaper. And when she moved to Washington State, the same company, she said, I can't afford an additional $300 for my premium every month. So that, one of the bigger companies allowed her for 3 years to pay the same price that she was paying in Oregon, but then just this year in July said we can't do that anymore. I personally feel Washington State is overregulated. I can assure you as a legislator, I will be looking, as I already have, at other exchanges. Look at the choices in Colorado. They have more than 8 companies. I'm happy we went from 4 to 8. I'm grateful for that. But I even want more and more plans offered. Hopefully, as a country, as we move through this, we will be able, and I've tried to sponsor the bill 2 years in a row, got it through the Senate, got it through the House Healthcare Committee, died in the House, where individuals can buy health insurance across state lines. The Affordable Care Act allows that. I honestly believe things will not change in Washington State until the healthcare consumer has a broader choice. And so as a legislator, you have to be focused, patient, but persistent, and keep talking about this. I, as always, never know if I'm going to run again in 4 years. One of the reasons I ran again last year was because I sit on the Joint Select Committee that is overseeing the Affordable Care Act, and I care. And you know, you don't just, this knowledge that's in your head, it kind of grows with time. And I still feel like there's so much I don't know. But I feel that I can contribute. And I think the dialogue among caucuses and parties is healthy if you can do it in a constructive way and make progress.
You know, I want to, the question I want to ask you, Senator, is how does this legislature compare to previous legislatures in which you've served in terms of their interest and their capacity really to understand the complexity of the healthcare system? But I want to preface that by just saying that, in my opinion, you are really an exceedingly very good and model senator. I seldom hear from you vitriolic partisanship. I see you work very closely. I've been in meetings with you, with Representative Cody, who is a left of center chair of the House Healthcare Committee, works at Group Health from West Seattle. And so I think that the kind of bipartisanship that I think you embodied, that a lot of other Democrats and Republicans in the legislature don't always as well, it'd be nice to see more of that. So how much more of that is there? What is the state of the legislature today compared to other legislatures in which you've served?
Well, I think, and I've talked to some of my Republican colleagues here today, we know that the Affordable Care Act is a federal law, and there's not the argument, I mean, maybe federal government's talking about defunding it, but who knows what happens in Washington, D.C. It's hard to figure that out. So I think we've accepted it. And the fact that many people voted yes on the exchange bill this year, mainly because they didn't want the money coming out of the general fund. So I think you grow into an acceptance. Doesn't mean you're happy, just as Anthony said. I mean, talk about red tape. You'd think the federal government would have learned what Washington State did in 1993. Instead, they've made some of the same mistakes. That's very unfortunate, because we know there'll be change. But as far as working, I mean, I've been in the minority 1/4 of my legislative career. you learn to be effective in the minority because that's the cards you've been dealt. And you have to have a sense of humor. I remember working with Senator DiCio, and I just said, Alex, I've decided there's an ant farm here in Olympia, and they're all collected underground, all marching along, and they're all connected. And we watch these people come in and testify, and I say, here comes the ant farm, because believe it or not, people move from agency to agency, and you kind of know where their political philosophy is, but you might as well laugh about it, because otherwise you would get really depressed when you're in the minority. So that's how you have a positive attitude, and I was so lucky. My second term in the House, we had the 49-49 tie, and I ended up chair of the Healthcare Committee working with Representative Cody. Every committee set its own rules, and we had the rules that we would decide which bills would be heard, but if one of them didn't want to go out of committee, it wouldn't. And so we, in those 2 years, did the individual market reform and the patient bill of rights. And it's just because of working in a bipartisan fashion, we were successful. I have to say, those 2 years, just like this year, to have 2 Democrats in our caucus with 23 Republicans, and I wasn't going to run for caucus chair again. I've had this role for some time, but they talked me into it. It's refreshing to have different ideas and to be told by Senator Tim Shelton, do you realize that you were having a caucus discussion that I never would have been able to participate in before? That's heartwarming, because that's what we're supposed to do, have critical conversations that are tough to have, but if you're going to solve the problems of the state or the world, that's what you have to do in a way where you aren't burning bridges.
Yeah. You know, Anthony, as I mentioned earlier, one of the reasons that the Empire Health Foundation has been willing to partner with us is because we try to focus on creating the space and let other people put the content in there, and we get out of the way of content. Sort of to Senator Parlette's point, why is it so hard for America, for Spokane, for Washington State, to talk about healthcare and change in a way that is not polarizing, that is respectful, that is, you know, moving the ball forward? I was going to say fact-based, but we can even disagree sometimes on what a fact is. Why is it so hard in healthcare?
DJ, if I had the answer to that, I could run for office. No. I don't have the answer to the question, but what I would say is, one of our earlier hallway conversations, one of the reasons that I value this conversation that's happening in this room on this day in Spokane, and the other ones that you have in the other states, is that you are providing a neutral space to say, look, we do have some role modeling. Thank you, Senator. And let's also have that in the field. Let's have that at the payer level. Let's have that at the provider level. Let's have that at the funder level. Really, it's this space for dialogue that I think is really critical. So I can't answer the root cause question, but thank goodness we at least have some workarounds.
So let me ask maybe not easier question, but
Great,
given your role in that as head of a foundation, which is the product of the purchase of a nonprofit hospital system by a for-profit hospital system, and the equity from that sale spun off into your now created foundation, how are things going in Spokane in terms of the conversation about what we ought to be doing in Spokane County, and the Inland Northwest? How are things going now in terms of collaboration? Because there's been some real breakdown in collaboration here in the last few years, and part of your role is, in some ways, you're a bridge because of your civic engagement, because of the foundation's role. You're a bridge, and you are thinking creatively about how to move the region forward. How are things going, given all of the change that's happened in recent years?
So I think it's been the Affordable Care Act / Obamacare has upended the ecosystem, and I think it's been a double-edged sword. And I think even just 3 or more years ago, if you said the word collaboration, you really only got the stakeholders to the table where that was a carrot for them. And with such a sea change, what you're seeing is unusual combinations in the ecosystem because now you also have a stick, right? And the stick could be as straightforward as change is coming and let's not get run over by it. Or it could actually be, it's pretty clear we're going to lose X, whether it's market share, financial return, so on and so forth. And so we have both sticks and carrots now incentivizing stakeholders in the ecosystem to come together and try to figure out how to collaborate. Sometimes those collaborations are just two organizations. Sometimes it's more complex to try to get a more holistic solution to better health. So overall, how is it going? I think we're in the moment. We'll have to reflect 10 years from now to really say how is it going in Spokane. My parallel is one of my favorite stories to tell is I was fresh out of law school. Yes, I'm a reformed lawyer. My name is Anthony. And I went to the largest Silicon Valley law firm. I had a computer science, electrical engineering background. And so here I thought I was hot stuff. I was tech background, lawyer trained, biggest law firm, right in the middle of Silicon Valley, all the tech revolutions, right? And, new client came into the office and told me his new business, and I just thought to myself, that is just the dumbest idea I have ever heard. Who would ever invest in that? And it was a little company that had this weird idea to find your future date or your future spouse on the internet. I said, what? That's crazy. We have way better ways of finding our future spouse, like meeting in bars. And who would ever invest in this idea? Anyone know what this company is? Go ahead, say it.
Senator Parlett knows it.
Senator, so go ahead and say it.
Match.com.
It was Gary Kremen, the founder of Match.com. And so I literally thought, who would ever use this service? And I looked it up a few months ago. To date, they have had 75 million registered users. Just Match.com, not counting all the whole sector that they spurned, right? And the reason I'm sharing this is because my takeaway, my theme on that story is we don't yet know what we don't know. And here I was right in the middle of the sector and the epicenter of the earthquake that was the internet revolution. And, who could have guessed, all the change from that? And so I don't think I would be able to answer your question until the 10th anniversary of the State of Reform Spokane. And ask me that question again when we'll be able to reflect how's it going in Spokane, because I think we don't have any way to gauge that right now.
Did you just commit to being a sponsor for the next 10 years? Is that what I just heard? You don't have to answer that now. We can
talk about fast on his feet, DJ. You just no.
I want to turn this over a little bit to audience questions. We've got a couple of microphones out here, and while you're thinking about it, we don't have too much time for questions, but I do want to offer the opportunity for people to come forward and fire a question. And Teresa, as people are thinking about that, I want to ask you. You sit in a very unique place on the Exchange Board with the Washington State Labor Council, and you take very much a consumer perspective, chair of the Healthy Washington Coalition, for instance. In these conferences and on our website, we get the healthcare business leaders, usually. We don't get a lot of consumers. We try to attract consumers. We've made a point of offering free passes to consumers here and on all of our events, but mostly this is healthcare business leaders. So from your perspective as a consumer advocate, what would your call be, your solicitation or your advice be to the healthcare business leaders of the community? What would you ask them to do on behalf of consumers?
Great. So this has been brought up a few times this morning, this challenge that we have in front of us. you heard the challenge about what it will take to get folks enrolled, but I don't think that it can be underestimated, the role that everybody in this room has, from small business owners to corporate executives to your neighbor to your mother. Everybody has a role, and the reason is this. We have a population right now who's currently either uninsured or underinsured. And when you ask them about their experience with shopping in the private market for healthcare prior to reform, their response is to say they are frustrated, they are confused, they are worried, they are feeling overwhelmed with the choices in front of them. And that's before healthcare reform took effect. Now, in the last 3 years, we've had a lot of political discussions. We've had a lot of news coverage about Obamacare or the Affordable Care Act. And even as early as April of this year, 42% of Americans didn't even know that the healthcare reform law was still law. So a few more statistics in terms of why it's so important for everybody in this room to see their role in getting folks enrolled and into comprehensive coverage. First of all, 78% of the public out there who is eligible for coverage don't know that they're eligible or how the law will benefit them. And then let's assume that we educate folks about the law that's out there. Well, according to Enroll America, 75% of the population, 3/4 of us, we say we want help, an in-person assister. We want somebody to talk to, either in person or on the phone, to help us get enrolled in health coverage. Because shopping for health coverage is very personal, and it can be scary. And what we want to do, I think, is take away the element of fear and confusion and get people to a place of feeling confident and informed, and to know that they have health coverage options that are available, not just through the exchange, but through the external market, which has new cost containment requirements and new quality and coverage requirements, and most of all, I think for the lowest income, to get the word out there about Medicaid. As we heard earlier today, almost 350,000 individuals in Washington state alone are going to be eligible for Medicaid, comprehensive care that is at no cost to these lower income folks. And I heard a story last week from an individual who goes out and does fairs, they do health fairs and community events, and they were telling people about the coverage that's available to them. And they mentioned, and as an eligible individual for Medicaid, you'll also have access to adult dental care. And the individual started crying, and they showed them a tooth abscess that they've had for a long time. And this is just one individual who's going to be overwhelmed with joy once they can actually get into comprehensive services. But getting to the point of actually being able to access that care requires folks to get enrolled and through the door. So I want folks to hopefully take away a sense of responsibility, a sense of what your role could be in this effort to get folks informed about healthcare. As we get to October 1st, hopefully there will be tons of opportunity for PR firms and news outlets to cover this, but that's not going to be enough. For the lowest income, for the most vulnerable, for people who've been shut out for a long time, even for people who are skeptical at any income level, we need folks who are trusted in the community to help get the information out to them. So a few statistics just that I wanted to provide for the audience. For men, the most important message for men is to be able to hear that there's now potentially relief from financial insecurity, that you're not going to potentially go bankrupt if you get an illness or a disease. That's a really important thing for us to remember. For women, a lot of women really want to hear about this is actually going to be coverage that's going to allow you to access preventative health services at no cost. And for women, that's a really important piece. For the Latino population, and these statistics are according to Enroll America again, for the Latino population, this might sound counterintuitive. A lot of people think that there's a distrust of government. And for the Latino population, the majority of them, 52%, would like to hear from the Department of Health or from the Medicaid office, or there is an entity that is a state or a federal health department that can help spread the word. That's who they want to hear from. So in addition to that, we've said before, and we all know, if you have a friend or a colleague of somebody you trust, if they've gone through the process of trying to enroll and was successful, they will listen to that colleague. They'll listen to their family member, they will listen to their neighbor, they will listen hopefully to folks within their business and in their work environment. And so I think it really requires all of us to see the role that we have and to really step up and say, PR efforts aren't going to be enough. We got to reach down, we got to reach into these communities and really help folks understand that there's coverage available to them that they may have never had before, and it requires all of us to help get the word out.
Great. Senator Parlett, if you could encapsulate your advice, your clarion call to the business leaders in the room in the healthcare sector, what would your advice or your call be to them?
Well, I think my advice would be to follow what you said, Teresa, but I think it's important to let the legislators know what's working and what isn't working. So if we are going down a path that we know isn't quite the way we had hoped, and if there's a possibility to reach the federal government to change directions, then we should do it. We found how the federal government allowed an extension on the deadlines for the exchange. Because this really is a grand experiment, and I just think we're going to have to speak up, be really smart about what's working and what isn't. But I have to ask this question. Did you use Match.com?
He actually wanted me to be a beta tester.
I couldn't resist.
I politely
I'm only on
declined.
Match.com to
I
beta
politely
test it.
declined, yeah.
Anthony, it doesn't look like there are any questions, so I'll give you the last word. What would your advice be to people in the audience, the healthcare business leaders? And I'll just preface that by saying, if the people in this room can't figure out healthcare, and the people that they represent in this room can't figure out healthcare, then we are all doomed. The converse of that is that you guys, we can figure this out. So how do we figure this out? What do you suggest? What is your call or your advice to the healthcare leaders in this room who can figure this out?
It's not so much specific advice because we have such a great cross-section on purpose by design of providers, payers, public, private, so on and so forth. But really, it's another underlying theme to take away here from the conversation of the day, which is it's going to be hard. There's going to be all these challenges coming up, and whether you're, in your physician's office all the way to figuring out the IT, to the insurance piece of it, wherever in the life cycle you are struggling as these key dates hit, October 1, January 1, is to not lose sight of a larger perspective, which is I was at a White House convening just a month or so ago of funders around this issue, especially related to rural issues, actually. And funder after funder of my counterparts got up and prefaced all of their comments, remarks, and questions with, well, I'm from such and such state, and as you may know, we are not doing the Medicaid expansion, and we don't have our own exchange. And literally, preamble after preamble was this. And then they talked about the challenges that they were facing as funders. And I thought, holy cow. We just don't know how well positioned we are relatively, nationally, to deliver on the promise of the triple aim. And we have an opportunity as a community, as a region, as a state, despite philosophical differences and whether or not this is a good idea and all those things, to actually make progress on the triple aim, better health outcomes, lower costs, better quality, and that could potentially be a role model for the nation. So not so much any specific advice, because I think that's so specific to the role you play in the ecosystem, but really it's a takeaway theme of we all have a part to play, and don't forget that we are better positioned than nearly everybody to be a role model.
Let's give them a round of applause.